Welcome to the webinar, The Growing Humanitarian Healthcare Crisis in Ukraine. With that statement, I think, which is very clear to everybody, the war in Ukraine is far from over as the country continues to face a growing humanitarian healthcare crisis. We wanted to use this opportunity to inform our followers and supporters of the situation in Ukraine with regards to healthcare in particular, and most beneficially now with Scholars at Risk Ukraine, where we have supported as part of the Heal Ukraine group, Scholars at Risk Harvard and Global Medical Knowledge Alliance collaborative that brought Ukrainian physicians and surgeons to the US and Mass General and Brigham and Women's Hospital in particular for higher training that could then be taken back, as well as the network of experts here that have continued to advise. We also have on our panel today, I'm just trying to change the slide here, the founding members of Health Tech Without Borders, Marianna Petrea-Imenokhoeva, and Dr. Jeff Hersh is online. And then from Ukraine, Dr. Sofiya Hrechukh from Lviv, Vadym Dr. Vadym from Rivne Oblast, a family medicine specialist and amazing multifaceted physician. Arkadii Vodianyk, infectious diseases physician and global medicine expert from Kyiv, member of the WHO team involved in all of this as well. And then hosted by myself, Dr. Mark Poznansky here at the Vaccine and Immunotherapy Center, co-founder of the Heal Ukraine group, and Dr. Nelia Malnichuk, assistant professor of surgery here at Harvard Medical School and Brigham and Women's Hospital, and president and co-founder of the Global Medical Knowledge Alliance. So I just would say at the top of all of this, you know, our hospital system has been morally incredibly supportive of what we're doing and helping us to, with regards to the staff supporting these programs, help us do what we're doing. But we're also indebted to these organizations, the Scholars at Risk Harvard University program that's led by Jane Unruh, Global Medical Knowledge Alliance led by Sergey and Nelia Malnichuk, the Heal Ukraine group led by myself, Nelia, and Jackie Hart in particular, and then Health Tech Without Borders, as I said, led by Jeff and Marianna, who are on the line today. I just, as usual on these webinars, wanted to sort of introduce the subject again of the war, because the news cycles in the US and around the world are so short, and eyes tend to be turned to whatever the most disastrous thing is of the moment, understandably, but there are disastrous moments that are continuing, and the unprovoked invasion by Russia of a completely independent country, namely Ukraine, on February the 24th with a full-scale invasion. So that's 2022, not 2002, and day 483 of the Russian invasion. And you can see the current Institute for the Study of War assessment of where the territory that is currently being fought over in the east of Ukraine, and the current, obviously, as we see in the news, probably massive counteroffensive that's going on, led by the Ukrainian army to retake its territory from the invading Russian forces. And we know, just as experience in the military and military history, that what is going on there, although it's not being shown in the news, must be some of the most severe war fighting that's occurred in Europe since the Second World War, with the type of level of casualties that hadn't been seen in Europe until now, given, you know, the experience of the Second World War. I think it's important to stress this point that across Ukraine, nearly 580 humanitarian partners providing life-critical aid, protection services to over 13.4 million people. This is an enormous undertaking of both networked and individual not-for-profit organization, individuals, large organizations, small organizations. We've written about it. Nelly and myself, and Jackie Hart have written about this. This is an extraordinary network of people giving of their time both freely and with support from donors to support the people of Ukraine in the rebuilding and defense of their nation. And then as of today, President Zelensky urged Western leaders to rebuild his war-torn country. And I think that's a very big emphasis that we've had in our Scholars at Risk program, which is that we're bringing Ukrainian physicians and surgeons to the US, which in part is to both train but also help ultimately the rebuilding of a new modern healthcare system in Ukraine with these pioneering leading physicians, some of whom we have on the line today, who are involved in the Scholars at Risk program. Just a few figures just to give you the scale of this: 6.1 million refugees dispersed through Europe. The other numbers with regards to the number of children in need of humanitarian assistance. And then on the right-hand side, the severity of what Ukraine is facing. And I think this latest quote from the WHO representative in Ukraine, Dr. Habich, the fact that the healthcare system in Ukraine continues to operate amid such circumstances is a testament to the heroic dedication of healthcare workers. And we're very fortunate to have Sofiya, Vadym, and Arkadii as representatives of those thousands of healthcare workers who continue to keep the healthcare system going. And that's despite greater than 1,000 attacks on healthcare facilities recorded by a number of different independent agencies, on hospitals, clinics, ambulances, you name it, part of a Russian military strategy of destruction and so-called kill twice effect. And then greater than 400 deaths of healthcare workers and patients documented. And then below that, these multiple alleged violations of the Geneva Conventions, civilian deaths, the looting of property and produce, mass killings, mass graves, war crimes, the so-called filtration camps, the movement of children against the will of their parents into Russia as part of forced deportation, and ongoing war crimes investigations of entities such as what are called cremation centers. So at this point, I just want to tell you about HUG, GMK, and SAR, the Scholars at Risk program. We've trained 7 Ukrainian physicians in person here who have returned back to the Ukraine. The medical specialties are broad, from psychiatry to infectious disease and surgery. We plan for another 4 to join in the next quarter of 2023. We've got the involvement of over 8 medical and surgical teams here at Mass General and Brigham and Women's so far, freely giving their time to help. And then the duration of the clinical observerships are from 1 to 3 months, with the funding per scholar required of about $9,000. So as part of this webinar is also a significant fundraiser that's successfully ongoing. There's a QR code on the invite. We encourage you to go there and donate. Your money goes only into supporting educational programs. And I would emphasize that all of the people on this webinar and all these people within their not-for-profits are doing all of this on their own time. The money that we raise only supports the educational initiatives. There's no even significant or insignificant administrative cost here, which is, I think, a great economy. So with that, I'm going to hand over to my wonderful colleague, Dr. Nelia Malnichuk, president and co-founder of the Global Medical Knowledge Alliance, to introduce her work with HUG, and also introduce the panel, and then we'll get started with our questions to the panel about the current situation in Ukraine. Thank you very much.
Thank you, Mark, and thank you all the panelists for being here with us today, and also for all the attendees and people who will listen to the recording as well. So as Mark said, I'm Nelia Melnichuk, I'm a colorectal surgeon at the Brigham and Women's Hospital, and I'm Ukrainian, as you can tell by my accent and my shirt. But I have been doing work in Ukraine for the last 10 years. I started with my academic work in Ukraine, where we noticed that a large number of patients in Ukraine are not being treated according to the guidelines. And one of the barriers to that was that large number of physicians in Ukraine don't speak English. And then also access to high quality evidence-based literature is limited by paywall. It's very expensive for physicians in Ukraine to have access to those resources. It's a little bit better during the war now. Lots of journals and societies have allowed Ukrainian physicians to access those materials, but it wasn't as prominent in the past. And we also don't know how long it will last. But basically, that led us to start the organization called Global Medical Knowledge Alliance, where we would provide high quality evidence-based educational materials for physicians in Ukraine in Ukrainian language for free. It's all available on our educational platform. We started with oncology. That was the biggest need in Ukraine at that time. We started this work in 2017, so way before the, as we say, big war, full-scale invasion has started. But when the full-scale invasion has started, we expanded our offerings. There were huge need for education on trauma, how to manage injured soldiers and civilians. And as you can imagine, Ukraine, for the most part, is a very peaceful country. And even with the invasion in 2014, still large number of physicians did not see the injuries that they see now, and the physician workforce had to be educated quickly on managing those wounds. The same thing with issues in mental health, and Sofiya Hrechukh will talk a little bit more about that, but basically we are trying to provide much needed educational materials in the forms of articles, videos, courses, for those Ukrainian physicians. And we also focus on patients too, to make sure they are educated and are active participants in their care. Since full-scale invasion, another thing that we have been doing together in partnership with Heal Ukraine Group and the Harvard Scholars at Risk, we offer hands-on training for Ukrainian physicians to come here to the United States, be observers in our hospitals, and learn much needed skills here that they can bring back to Ukraine. So those are kind of two main areas of our focus. We have been providing Ukrainian hospitals with humanitarian aid as well, focusing on medical and surgical supplies. But as my husband likes to say, that it's very actually easy for everybody to understand the need of medical and surgical supplies, and those are definitely much needed. Tourniquets are needed, surgical supplies, new equipment is needed. But as much as those supplies, we need education. We need people to know how to use them, but we also need people to treat patients well, to treat patients according to the guidelines, to minimize the mortality, to minimize morbidity, to make sure the patients have good outcomes. A large number of Ukrainian soldiers, after they are being treated, they come back to the front lines. So we have to do our share. And as my husband says, software is as important as hardware, and probably even more important. So we're trying to help Ukraine with that need, focusing on those educational opportunities. And here we'll hear from our 3 observers, who all from different specialties. They learned something here that they were able to bring back to Ukraine to implement, and hopefully we'll hear about impact of that program that we are providing for them. I think Mark already introduced Dr. Vadym, who is a family medicine physician, works in rural area in Ukraine, spent some time at Mass General, in multiple departments. I think he's probably one of our observers that that visited many departments and actually knows about Boston much more than I do. And I was asking for his advice where to take some of the visitors, because when we live here, I guess we don't know the place that well. But he'll tell us a little bit about how he has been using his knowledge that he learned here and connections that he made here to implement some programs in Ukraine, especially in point-of-care ultrasound. The same thing with Dr. Hrechukh, who is a psychiatrist and spent 3 months on psychiatry service at the Brigham, learning how to implement liaison psychiatry in regular hospitals in Ukraine, and the same thing, made a good amount of connections here, who's supporting her as she's moving forward in her new position, bringing liaison psychiatry to Ukraine. And then Arkadii Vodianyk, who is infectious disease specialist and created a large network of support here and spent time here learning about antibiotic stewardship and how to implement that in Ukraine. And in Ukraine, there's a big issue with resistance in the wounds, antibiotic resistance in the wounds, large number of patients receiving antibiotics that they might not need, and infection control is difficult. And then we're also very happy to have here founders of Health Tech Without Borders who will tell us about their work as well. So I'll turn it over to Mark.
Yeah, so I'm just going to launch off with a question. Maybe each of you could have a couple of minutes just to talk, just go around the group, starting with Sofiya, about what you see, what your personal experiences of the current situation in Ukraine in general, and then, you know, specifically with regards to your specialty, in case of Sofiya, you know, with psychiatry.
Hey everyone, good afternoon. Thank you for having me here. To start, I would like to thank Nelia and Mark for giving us the opportunity to go to the United States and to learn stuff. As Nelia mentioned before, I have recently been picked for my new position as the head of the department, of the only one in Ukraine department actually having both inpatient and outpatient psych help. So because of you helping me, I am the head of the department now, and I'm going to be trying to bring something bigger, something better for Ukrainian people, for civilians and soldiers, because the needs of mental health care in Ukraine are rising every day, unfortunately, because every 4th to 5th person in Ukraine is affected by war in regards to mental health, especially with anxiety, depression, PTS. I'm not trying to say PTSD because it's, well, naming it a disorder is a bad idea, especially when you're communicating with soldiers. They hate when you say disorder, so I'm trying to avoid the disorder part. It's affecting everyone, and mental health workers as well. Like I mentioned before, lots of us trying to help people drain with our own resources. So I want to emphasize that the best thing we need from the people around the world is training, especially for therapists, because recently I had a case with a patient who has been tortured for months, and it was very difficult for him to talk to me. I'm a woman. I have never been to war before. I have no idea how to shoot people. So it was super difficult for me to work with him because I have no trainings at war stuff. I have no idea, and I'm a woman. He couldn't tell any torture specific stuff to me, especially the sexual torture part. So I want to emphasize that the best thing that we need is not having humanitarian aid, drugs, or something like that. It's the trainings, because I have no idea how to work with those people, with soldiers and civilians who have suffered so much. I have no idea. I'm trying to be as empathetic as I can, but I'm not sure if I'm not doing harm to those people. So the best thing that we need is trainings, and I'm going to be asking this lots of times because I need to build my own team, and I want to start something as helpful as I can build. So that's why we are looking for therapists in Ukraine, and they need trainings. So we would be super thankful if anyone could do this for us, bringing trainings to Ukrainian psychotherapists and psychiatrists, maybe child psychiatrists as well, because the needs will be rising as the war is still proceeding. We're still at this, we're still trying to cope, but the worst parts will come when the war is over, because that's the way the trauma is forming. While we are coping, we're going to be as resilient as we can be, but when it's all over, 3-4 months up to 6 months, the trauma will build, and the trauma will be so big I cannot even imagine. So we have to be prepared for this. They have to be prepared as well as we can.
Yeah, Sofiya, thank you for sharing those experiences and insights. You know, facing the consequences of all of this horror from a medical perspective and a psychiatric perspective is a reality that we have to recognize. And I appreciate what you're saying. Arkadii, from your perspective, what do you see currently, personally, and professionally in Ukraine?
Yeah, good afternoon, and thank you for the floor. I would like to start with highlighting the number that you showed on slide, that the number of attacks on health now is over 1,000. And this is only the WHO verified attacks on health, which is below the actual number, and the number which is provided by the Ministry of Health is way higher than 1,000. And all of these attacks on health, they create enormous numbers of challenges for healthcare facilities, direct and indirect. And also, it's important to mention that these challenges, they're unequally distributed throughout the country. So some of the healthcare facilities, they experience constant shelling and challenges that are connected with this. Another experience there, for example, influx of a lot of patients that come simultaneously to receive care. And these contribute to the accumulation of number of challenges, like, for example, growth in number of infections caused by bacteria with antimicrobial resistance, which Nela was referring to. But I would like to also mention several developments that happened recently, and I think they are very informative for the further work and support to healthcare facilities in Ukraine. One is that the preparedness really pays off and is really important. At the beginning of at the end of 2022, a lot of initiatives were focused on ensuring the uninterrupted water supply to healthcare facilities due to challenges with the electricity supply. And although currently the situation with electricity is way better than at the end of the last year, now we have another issue with the water supply for many, many regions due to explosion on the Kakhovka Dam. But those preparations that were done by healthcare facilities now become very, very helpful for very many of them. So regardless of where the threat comes from the missile that attack the dam or missile that attack the electricity, it's important to strengthen the preparedness of healthcare facilities. Another example is that despite all of the challenges, currently Ministry of Health approved two very important orders, one on the ensuring the minimum infection prevention control requirements for each healthcare facilities, which are in line with WHO minimum standards, which are quite high. So starting from the next year, healthcare facilities should comply with these standards, which is very, very important to ensure safety of patients. And also now we will see the enhanced surveillance for antimicrobial resistance, which is also a big endeavor, but it's very, very needed to improve the situation. So my observership in Mass General was very helpful to support government with all of the mentioned above initiatives. I would like very briefly mention one that just after the return from Mass General Hospital, we initiated the development of cumulative antibiogram in one of the healthcare facilities. Now we finalized it and discussed with the Ministry of Health the possibility to roll out it to all healthcare facilities that has software for data collection, which is 1/3 of all healthcare facilities. And these days, the results that we obtained showed some very worrisome situation, but also some opportunities how we can improve the treatment of patients. So really would like to thank for the opportunity to be part of this, and would like to mention that for this war, because of this uniqueness in terms of scale, I think we have not very much ready solutions. So the training and the adaptation of this knowledge in the country context is extremely important. And without this, I don't think we will be capable to ensure that healthcare facilities provide uninterrupted support now and care now, and then improve in future. Thank you. Over.
Thank you, Arkadii. That's, as usual, incredibly detailed and insightful on this issue. Vadym, you've been, I can see you're wearing your Hocus Pocus ultrasound shirt. Excellent. Do you want to talk about what your experience is back in Ukraine now, in the rural area that you're in, and the programs that you've been able to move forward?
Yes, dear colleagues, thank you for having me today. Thank you for inviting to Boston, and I love Boston even now. Boston's buildings, the bridge, and the Museum of Boston Tea Party, it's beautiful. But I can't live without Ukrainian borscht, and I come back. Now we have much more air siren, almost every day, maybe 2-3 air siren, but these air siren don't stop our training. Even in a day when Andriy Liteplo, professor of Harvard, come to Rivne city and air siren started, we continue our training in a bomb shelter. It's a beautiful experience for us, for our doctors, and for doctors from Mass General Hospital, Harvard Medical School. Maybe half hour ago, I sent a list of our activity, and Mark said that it's a huge list, not for one man. It's not my list. It's a list of my 4 daughters, and also all our team who work with me. It's a Focus ultrasound team. It's a beautiful doctors, very experienced. It's a Academy of Family Medicine of Ukraine. It's the Christian Medical Association. We provide several trainings, and because of thanks to negotiation with Butterfly, it's ultrasound, portable ultrasound. We obtained 100 portable ultrasound and distributed on our training for military doctors. Also, I took part in 2 podcasts. And we started discuss medical education. It's a very tense discussion. Sometimes our listeners said that it's impossible to build such system of education in Ukraine, but some said we must try. Also, I took part on several conferences. Some of my speech name how to build Harvard in Ukraine. And we want to build better than Harvard in Ukraine. Even 3 days ago, I come back from Azul School of Family Medicine, and 40 best family doctor of Ukraine obtaining new skills, the focus ultrasound skills, and also we discussed disruptive innovation. It's an interesting term that professor of Harvard, Clayton Christensen, firstly described it, and we discussed it, how this disruptive innovation we can use in Ukraine. Also, I think that most useful thing it's our training for military doctor, and we have many questions from military. I'm not military. I don't understand how military doctors work in the battlefield, but they ask many questions, and we ask you maybe for help to understand how to organize a system of evacuation, how to use ultrasound more effectively, how to use Doppler ultrasound to understand is it viable hand or other limb. It's a big problem. We don't have such scientific research information to understand how to organize. Even Andriy Liteplo, who visited Rivne and provide training with us, told that we have another type of war, not as you Americans have in Afghanistan, Syria, but I think that you have all information and possibilities to help us understand how to use it in a battlefield. Also, I share my knowledge and skills with our trainers, Focus Ultrasound team, and our trainer also asked me many questions. And if it is possible, I think we don't need 2-3 months observership, maybe 2-3 weeks to practice in such a simulator as I have in Harvard Medical School for our trainers. And again, I want to thank you very much for this huge work that you did. Thank you.
Thank you, Vadym. It's very much appreciated, all that you're doing. Marianna, tell us about, again, the view of Ukraine currently and what you see as the things that Health Tech Without Borders is doing and where you're going from here.
Thank you, Mark, and thank you, everybody. And first of all, I wanted to say that to share my full admiration of our colleagues in Ukraine. Really, so we discussed before the starting this call that we should somehow keep up, be more positive, be more focused, and this is like the best thing which I had today. Thank you so much, everybody, so for your energy, for being so kind of believing and doing your work in so difficult circumstances. And of course, everybody and everything what was said resonates with me a lot. So what said Sofiya about the situation with the mental health, and this is one of the programs which Health Tech Without Borders is running. It's helping healers heal, it's peer-to-peer support, and this is how we addressed actually this need. And this is how we are going through this war together with Ukrainian psychologists and mental health professionals, and I really understand what you are talking about. I'm not a mental health professional, but it's so complicated, and we looked for so long time for the experts in different areas, like the victims of assault, the children psychiatrists, and it's really difficult task. So there are not so many experts in the world which can really help Ukrainian mental health professionals right now with the knowledge. And also what Arkadii said about the influx of patients, was our first task with telehealth, which we delivered during the first 2 weeks or when war started in Ukraine. We started from telehealth support, and now we reached the point when we delivered more than 160,000 consultations together with our partner in Ukraine. This is Ukrainian platform, Doctor Online, and thank you so much to our partner for doing this work with volunteers and volunteering time, and of course effort, resources, and everything. And we are very familiar what Vadym is doing with the butterfly and this absolutely beautiful devices. We also provided a few sessions, educational sessions, and I wanted to mention one thing which we launched recently. This is tactical medical chatbot from Health Tech Without Borders in Microsoft disaster response team, where we somehow try to cover the tactical medical response in the way of chatting with chatbot. And we hope that this tool will be efficient for students to prepare, also let's say not medical professionals. One piece which is also Nelly is delivering in-person classes and online for the videos. This is Stop the Bleed part for citizens or civilians, sorry. So this is also incorporated into the tactical medical chatbot. So thank you.
Marianna, thank you very much. Jeff, you want to talk a bit more about some of your work, especially in light of the water situation and so forth?
Yeah, thank you. Nelia, it was just insightful how you differentiated what you called software and hardware, and I could not agree more. And I also agree that the software right now, as you've heard from the people who know best, Sofiya, Arkadii, and Vadym, how important that is. So it's a little bit boring that I'm going to talk a little bit about the hardware just for a second, so I'm going to be as quick as I can. Arkadii opened the concept here, and I hope if you can see my screen, I'm just going to go, I hope very briefly, just focus a little bit on the WASH aspects. So if somebody will just shake their head and say, you can see my screen, yes? Okay,
Yeah.
good. So I just want to go really quickly. WASH is basically just an acronym for water. So for water, sanitation, and hygiene. And we say water is life, and I'm not sure it could be more true. Everybody knows how exciting it is when NASA says, well, we discovered water on a planet or on the moon, and how important that is, because how important water is to sustain life. So knowing that water, sanitation, and hygiene are basically just human needs, the question is, how are we doing in general? And the answer is, we're really doing poorly. About a quarter of the planet does not have reliable access to safe drinking water. About half the planet does not have sufficient or limited, sometimes not at all, sanitation services for human waste. And as you heard Arkadii speak to, healthcare facilities are in general doing poorly. And I'm not talking just about hospitals, I'm talking about healthcare facilities in general, including clinics, where their ability to provide the appropriate level of hygiene is incredibly limited. So why is this germane to what we're talking about in Ukraine? And the answer is the destruction of the dam on June 6th set things back just incredible. 80 towns were flooded, sanitation was disrupted, hospitals, about 20 healthcare facilities have ridiculous amounts of hygiene limitation. Multiple hospitals had to be evacuated. So, why is this a bigger issue than it might be? And the answer is the flood not only compromised the water supply, but the water that's there is significantly tainted. And it's tainted with chemical contaminants, it's tainted with heavy metals, and there is a huge risk that at any moment there could be an outbreak of infectious disease because of the limitations of the water. What you can see on the right of the screen is a chemical analysis of some of the water, and basically it shows that it is extremely dangerous and not potable. So what's there? So what is Healthcare Without Borders doing about this? Well, we've partnered with multiple different partners, Med Global, IDMC, Vans Without Borders, and multiple others, to try and address this issue by helping with the hardware issue of trying to get some water purification systems, water pumps. You heard Arkadii talk about the limitations of electrical supply, etc. So there are two different directions we need to go. One, and if you look here, I'm just going to speak to the fact that the water solution that needs to be put into Ukraine right now has to include addressing the chemical burden, the heavy metal burden. And so the systems that are important there are these reverse osmosis systems, which are a bit more complex and unfortunately a bit more expensive. Finally, just to talk a little bit about other stuff that Health Tech Without Borders is doing, we are also addressing the WASH needs in multiple other places on the planet, not germane to this talk so much, but where there are places where you can only deal with the infectious disease aspect, some of the solutions can be much smaller and much cheaper. But to focus on what's needed in Ukraine right now, are these water purification systems that can address chemicals and heavy metals, as well as these other issues. So basically, that's the deeper dive on water, sanitation, and hygiene, and why the ramifications of the demolition of the dam are so far-reaching, not just geographically, but in time. And this is just huge, and it's going to take quite a long time to come back.
Do you, just quick follow-up question, Jeff, do you see an increase or waning interest in being supportive to Ukraine on an issue like WASH and water supply and so forth, or has that resharpened the sort of the organizations that are helping Ukraine's focus? And
there's been some focus on it, and as you've heard here, the software focus is so important, and I absolutely do not want to detract from that in any way, shape, or form, because this is the classic: if you give somebody a fish, as opposed to if you teach them to fish. And that's what we're talking about here. And that, I think, is what Nelia very articulately mentioned when she talked about the software issue. So that is incredibly important, and bringing that expertise back, as you've heard Vadym and Arkadii and Sofiya speak to. Wow, that's that's just huge. But yes, there is a recurrence here, and especially when you start to see things like some of this contaminated water pouring into the Red Sea, you start to see some of the ramifications of it. You can see how far-reaching this is, not just, again, geographically, but this is not an easy fix. Sanitation has been disrupted. The water supply has these chemicals, which are just going to now sit down in the bottom of the rivers when as the flooding recedes. And so this is a long-term issue, and this is a huge, huge issue.
Yeah. Nelly, I'm going to hand it over to you to ask the next round of questions. If you want to take it away.
Yeah, no, thank you. And Jeff, I totally agree. Software is important, but hardware is important here too. I mean, the Kakhovka, the explosion definitely brought a lot of concern for infectious disease and water supply to Ukrainian villages and Ukrainian people. And actually, my question is based on that. Arkadii, are you seeing increase in infectious diseases in those villages? Are you seeing anything related to that, or is it too soon to see the effects yet at this point?
Yeah, I think it's important to mention that this explosion affected two sides of the river, which left side was affected way more severe because it's more flat. And Ukrainian government doesn't have access to the left bank, so we cannot assess the impact. And the impact is way bigger to the left side of the river than to the right, just because of the geography. Talking about the right bank of the river and all of the measures that are taken, they are focused on the surveillance on the outbreaks of infectious diseases and also contamination of the water. And currently, almost half of all of the water samples are not in line with the standards. So there are a lot of communication with their population on what water should be used and how to prepare water before drinking, etc. So fortunately, we do not observe currently the increase of the waterborne diseases or other types of infectious diseases. But I would like also to mention that the drinking water needs are only like 2% of all of the needs of the population in terms of the water. So we expect that in nearest future there will be a lot of issues with the all other areas where the water are needed, not only to drink, but also to the production, to the farming, etc., which also will indirectly influence both population and healthcare in these regions. And over than 3 oblasts and huge amount of territory were relying on this water, not below Kakhovka Dam, but also above, which were taking the water to supply big cities. So I think that the long-term consequences will be way harder to address and will be way more sensible that immediate one, although immediate one are devastating. Over.
Thank you. And Sofiya, in terms of mental health crisis and preparedness for that, kind of what is going on the national level in Ukraine now? Are there more physicians being prepared for that, more courses, any initiatives that you can speak about that, and anything that we from this side we can help with?
Thanks for the question. I had like 4 clinical cases last week considering the Kakhovka disaster. I had 4 stable patients. They were completely fine, taking their medicine, having therapy. Everything was completely fine. But after the news, they had 4 of them had mental breakdown. So they were stable 24 hours before. And after the disaster, the world has changed for them and they required inpatient help. So I kind of tried to avoid being inpatient because it's stressful for the patients, but still I couldn't avoid it. So yes, it has impacted mental health as well. It's unseen, you cannot see it, you cannot feel it, touch it, but the patients are complaining much more now because of the news, because of the Facebook news, because of the internet and stuff. So we are trying, me and my residents actually are trying to develop new channels, YouTubes and Telegram chatbots and stuff, for trying to be as resilient as you can be. And I'm one of the speakers who's gonna do some interviews with the patients if they allow me to do the interviews with them. So we are trying to be as helpful as we can, as I mentioned before. And next month, I'm going to Barcelona for leadership courses. Hopefully, I will present my slides and my area of work and maybe get some expertise on how to help people more and how to build a better psych help for the patients, for the normal response to unnormal news. That's my favorite quote of myself. So yeah, it's hard, I know, but we are still resilient. We're still fighting our demons and someone else's demons. So we're gonna be fine, but we need some help in terms of trainings and resources for mental health workers as well. And I'm gonna be doing some research on impact on mental health of mental health workers to help myself, my residents, and my colleagues as well, because we need resources to be resourceful for the patients.
What about on the national level, like the Ministry of Health? Are you getting resources there nationally?
We are trying to get it like from the Ministry of Health. It's a little bit harder. So we are trying to build our own network of sponsorships and, well, people interested from all over the world. But in terms of Ministry of Health, we are building and opening new mental health centers. So that's the impact of the Ministry of Health from my perspective. And bringing back psychologists and psychotherapists to the hospitals, especially general hospitals, which is super important nowadays. And we get sponsorships from the Ministry of Health and some scholarships for psychiatrists. So yeah, that's the impact from the Ministry of Health. We are very thankful for this, and hopefully it will continue for us.
And I have a quick question to Marianna, and I see we also have another question in Q&A, but let's ask Marianna first. I know Health Tech Without Borders is supporting mental health providers in Ukraine. Can you tell us a little bit about the mechanism of how you do that?
Yes, so initially we started, as I said, from the webinars. It was exactly like 1 year ago in May. Because we try to find experts, mainly in the United States, for the victims of assault during the war, which is a very kind of tiny topic. And then we realized that we can deliver the peer-to-peer support to help Ukrainian psychologists, exactly what Sofiya is explaining, yeah, with the secondary trauma, with burnout, with having the moral distress, not being able to help everybody. And this is really kind of happening, I think, with all, including the NGO people, because we want to help, but we don't have resources. We don't have like funding. We don't have people resources, man hours, but the needs are growing all the time. Yeah. And we should be very kind of meaningful, like how we spend these resources to be very productive in this way. Yes, and I would be happy if Sofiya will be able to join this program as well, because it's like absolutely free. We have volunteers and already experienced people supporting each other. It's not like we can answer in educational purposes on all questions, because the problems in Ukraine are so unique and sometimes so complicated that probably we don't have even experienced experts in the world, because sometimes our American colleagues say something like, you know, Ukrainians will teach us soon. how to deal with this because they have more experience and they're going through this. So yes, but this day-to-day support, and of course, especially when we have this big waves of something is happening, and it's the first wave is coming to the mental health professionals, psychologists, psychiatrists, and they need to share it with somebody. And this is the moment when this program, Helping Healers Heal, actually works very well. I hope, and we believe in this.
There's a question in the chat. Thank you, Marianna. There's a question in the chat about preparedness in the event that the Zaporizhzhia nuclear power plant is compromised. I hand that to Arkadii, the so-called CBRN training and so forth. But are measures in place if that the safety is compromised in the event of a nuclear power station leak or destruction?
The specific CBRNE preparations in many healthcare facilities started no later than like March 2022, just from after full-scale invasion. And actually they were supported by many international organizations and non-governmental organizations coming to Ukraine to share knowledge, including from US. And I think we have very big support in this regard, including chemical preparedness, radionuclear preparedness, etc. But I don't think that you can be like prepared for such events. So even like don't like to think that it can happen. So I think that the awareness is there. A lot of activities are ongoing, and I think they will be even scale up, but they were very active during last year and currently as well. But yeah, the scale of the disaster is such that I don't think that it can be like adequately prepared for this because of all of the issues that attributed to this.
I wanted to, because we've only got a few minutes left, I just wanted to pitch a couple of questions to Vadym and Sofiya just about, I mean, you have an opportunity as we circulate the recording of this to sort of speak to both our supporters and other people who are interested and sort of Ukraine-centric in terms of understanding the importance of what is going on there with regards to sort of world history, its impact. What you see in the near future for Ukraine in your areas, and whether it's in healthcare, in the community. Vadym, you're looking after, or starting with Sofiya, you paint a pretty severe picture of the mental health care needs and even just keeping up from them on a day-to-day basis. What do you see in the future? Do you see reconstruction in that in your view yet, that's happening, or how that can happen at this time? Sofiya first and then Vadym, just briefly.
I'm a big believer in future, so I have no doubts we're going to build something working and something worth, but we need to unite for this. We need to have the common aim to build something new and big and better. As Dasha Simchuk, my friend, said, it depends on us. So I have no doubts on that we are going to be able to build something big and worth, but with your help, with the international help, with our internal help, we need to just to believe in this and do something as big as we can. Everyone is helpful, everyone is helping, regardless you're here in Ukraine or in Boston or anywhere else. It doesn't really matter. So I have no doubts. I will be happy to proceed with working with all of you. And Marianna, thanks for inviting me. I will do anything that can be at least a little bit helpful for people from Ukraine, and maybe in future all around the world, because I'm pretty sure the Ukrainians gonna be doing trainings for other people. If something bad happens in the other countries of the world, we're gonna be flying there to help. I have no doubts about this. I don't want to wish something like that to any country in the world, well, except Russia. But I mean, we're going to be helpful, and I'm pretty sure about this. So I have no doubts that we're going to succeed in this.
Yeah, thank you, Sofiya. Vadym, what do you see in the short to sort of midterm future, the concept of reconstruction?
Yes, thank you. I am not so young as Sofiya, and I don't live in the future. I live now. And even now I understand war, it's evil. But even now, our medicine cardinally changed. Many family doctors ask question how to use ultrasound. Many military doctors trying to use blood on a battlefield. We never do this before. And it will be impossible without your help. 3 days ago, we finished Azov School of Family Medicine and discussed it. Psychiatry, disease, post-traumatic stress disorder, and also we discussed how to invite 2,500 doctors who come to abroad, how to invite to our country. Even now we started this reform, and I think it's possible. It's not future. It's because of your help. It's now.
Yeah, Vadym, thank you so much. Thank you for all of the panelists for their for what you're doing, but also for that optimistic view in the face of great adversity. Nelia, any final words from you? We've got 1 minute.
Yeah, no, thank you to all. I wanted to mention our organization was actually one of the organizations to provide CBRN training in Ukraine, both through educational materials and in-person trainings. And I just want to echo what Marianna was saying. The whole world is getting tired, but we cannot afford that. This is managing Global Medical Knowledge Alliance. Seems like it's a much bigger job than being a surgeon now. And I tell myself constantly, if Ukrainian soldiers can be in trenches and can be fighting, I can continue doing it, but we do rely on support of others. We cannot do this alone. We have to support each other. We have to continue support Ukrainians and Ukrainian physicians and Ukrainian patients. We have no choice. We don't have any moral choice here. And we do hope that world will continue supporting us and donors will continue supporting our work so we can do it more efficiently.
Yeah.
Both hardware and software.
So just to round it up, you've got that QR code associated with the invite for donations to GoFundMe, which goes to the Global Medical Knowledge Alliance, as I said, only for supporting the educational programs that have been talked about here. And we really appreciate all those who have given, and we appreciate all that have all of you on the panel that have spoken so eloquently about the current situation, the healthcare crisis and reconstruction that's going on there. Thank you very much indeed. Thank you.
Thank you so much.
Thank you.